How to get rid of outside hip pain and get back to running. So, do you feel pain on the outside of your hip, especially when you're running, walking upstairs, or lying on your side at night? You're not alone, and this sounds familiar. You might be dealing with something called gluteal tendinopathy. I'm Dr. Ray Peralta, physical therapist and run coach, and I've been in the field for almost 10 years, helping athletes get out of injuries, get back to running, and even get faster, improve their performance. And today, I'm breaking down what causes this type of hip pain, how to fix it, and how to safely get back to running stronger than ever. So, this condition, gluteal tendinopathy, is one of the most common causes of that outside lateral hip pain in runners and active adults. It's typically felt right at the outside of your hip and can even extend down the outer thigh, especially common in women over 40 who are 4 times more likely to experience it than men. In fact, nearly 1 in 4 middle-aged women may be affected. But it's not just older adults. It can also impact younger runners or anyone doing a lot of repetitive hip moving, like runners. This includes, again, walking long, running, stair climbing, or standing for long periods. And symptoms often get worse at night, especially if you're lying on that painful side. And activities like running, sitting too long, or carrying heavy bags on one side can often worsen this. So, here's the thing. Not all hip pain is truly coming from the hip. Many people make the mistake of Googling their symptoms and jumping to conclusions. But pain in this area can also come from the lower back or pelvis, and those often get missed, even by healthcare providers. Even images like MRIs don't tell the full story, right? You think that MRI is going to give you the root cause, but it rarely does. The thing is, research shows that 73% of people with zero hip pain will show damage on the MRI. And then 69% of people with labral tears show it on the MRI, and they'll even know it until they got the MRI. Like they're not even in pain. It was just part of the study. And they're like, whoa, I have a labral tear. They even know that it had a labral tear or a bursitis or something, yet they're not even in pain. In another study, in hockey players, 2 out of the 3 hockey players, so two-thirds of them had degenerative changes, and yet they felt totally fine. And they're like, they're surprised they got the MRI and they felt totally fine. And in another study, the extremity pain of spinal source, the XPOT study, research found that 71% of people with hip pain actually had a spinal issue. That means that their hip pain was actually coming from their back, 71%. So bottom line, don't rely on symptoms or scans alone, and get assessed by someone who understands mechanical diagnosis and therapy. Someone like myself, I actually am a diplomat in MDT, or mechanical diagnosis and therapy, also known as the McKenzie method. And that's how you find the root cause, not just the pain site. So once you know it's gluteal tendinopathy, your first step is to reduce stress on the tendon and calm things down. You start with gentle isometric exercises like pressing the leg out onto a wall to activate the hip without movement. This can reduce pain and start rebuilding strength. Avoid anything that irritates it. Right? Don't lay on the painful side itself. Don't carry bags or backpacks on one hip, and avoid hills, long runs for now. Again, these are temporary things, but for a temporary period of time, usually a month or so, you want to avoid these things that aggravate it. And if you're overweight, that may also put more stress on the tissue, on the tendon. So even losing 10% of your body weight can significantly offload that tendon and help with healing, right? Because a lot of these people don't know this. When you're overweight, you're actually in a low-grade state of chronic inflammation, and that inflammation can delay healing. Oftentimes, people who are overweight or obese, who even if they got surgery, oftentimes have a delayed healing process just because their body is just already in a constant state of inflammation. So just getting to a healthier weight will just help you in the long run and help you with healing if you're already in pain, let's say dealing with this gluteal tendinopathy or outside hip pain. So when things settle down, it's time to build the tendon back up. So you want to progress your exercises by adding ankle weights or resistance bands. So let's say you're doing leg raises. Oftentimes with the gluteal tendinopathy, you're doing outside hip abduction or straight leg raise. So you lie on your side, you're doing that side hip abduction, or standing against a cable machine, bands. And then once that's easy, you progress and you can start doing heavier loading, right? Doing barbell squats, split squats, doing lunges, side lunges. So lateral lunges, you do it with dumbbells, kettlebells, or even a barbell going side to side. Because when you go to side to side motion, that's going to strengthen the hip abductors. And this is the part of rehab where most people go wrong, right? Either they push too fast, they try to skip stages too fast, and they flare up and they blow up, or they don't push enough. They don't strengthen hard enough, right? You want to do and a weight or an exercise that fatigues you, usually in the 8 to 12 repetition range. That means by the time you get to the 12th rep, you're completely fatigued. That muscle or tendon is really fatigued. Sometimes you can go to like 15 rep range. But if you're doing these reps or that you're feeling fresh, it's too easy, you're not feeling any discomfort whatsoever, because when you're doing the strength training, you might feel some soreness or discomfort. It's okay if it calms down within usually within a day. Now, if you do the heavy strength training and you're sore for the next 2 or 3 days, that means it was too heavy. You have to scale the weight down a little bit. So typically you do this heavy strength training. There's also different loading protocols, like the heavy, slow resistance training, where you go slow 3 seconds for takes the squats, 3 seconds to go down, 3 seconds to go up. This slow, heavy, slow loading protocol. But again, the weight should also be heavy too. You just can't do body weight if it's too easy for you. And then you do that 3 or 4 times a week. Again, a day off in between this heavy loading protocol. And then with the right type of strategy, following this, when you start with the isometrics, the free weight training, the tendon rehab usually can be done in 3 months or so. And be patient, and then make sure you're tracking your progress, what you're actually doing in the gym, or if you're working with a physical therapist, to make sure that you're progressively getting stronger, right? If you're staying the same and this pain is staying the same, oftentimes you're not progressively loading it to actually cause it to remodel, get strong, because it's all about tendon remodeling. That means you have to build with tendon and tissues around the tendon. So in this case, the glute muscle, and including the glute tendon. And then before you start running again, your hip also needs to be ready to handle that impact loading. So running is a high impact sport. That means every time your foot hits the ground, it's 2 to 3 times body weight going through your leg. So your hip to be able to handle that, it also handle that essentially your single leg jumping or hopping on one leg. So you're gonna do plyometrics. So running again is a series of single leg hops. So to prep for that, you're gonna do things like box jumps with lateral bounds, and even power cleans with a barbell, right? You can even do jump squats. Things to get your hips to handle the impact of loading. And then there's different loading strategies you can do for this, right? You do low reps, for example, 3 reps of big jumps lining off a box, single leg jumps, triple jumps. As long as your hips are able to handle it, it should, again, be minimal discomfort. And if you do get sore, you should recover within a day or so. So that way, now you know that your hip's able to handle the impact loading of running, right? You can handle the eccentric forces every time the leg hits the ground, so you don't re-injure it when you go back to running. Because the hip abductors are actually very important during the stance phase of running. That means they kind of stabilize the hip. So when the foot hits the ground, right? If the hip abductors are weak, it kind of causes the hip to drop. You got that pelvic drop or hip drop, and that's going to flare up that tendon again. So if the hip tendon's really nice and strong, every time that opposite foot hits the ground, and then as the other foot's clearing the ground, it stays level and it doesn't drop. So a stable hip is going to be a strong hip, and then you'll be able to handle running without getting a flare up of your hip, and especially the long runs and going up and down hills and even uneven surfaces. So then when you are ready to go back to running, I recommend doing a run-walk protocol. Don't just go to straight ahead running. So start with, for example, 20 seconds running, and it should be easy. It shouldn't be sprinting. I'm talking about jogging, very easy, slow running. So for example, you can start with 20 seconds of running or jogging, followed by 40 seconds of walking. And then do that for 10, 15, 20 minutes as your fitness improves. If that feels good after a week or two, you can start building it up. Again, the pain should stay when you're doing this running walk protocol. The pain shouldn't go more than like a 2 out of 10 pain or discomfort, or ideally no pain at all. So if you've done the other stages correctly, oftentimes people are able to do this with almost minimal or no pain. And then eventually you want to work up to doing, for example, 5-minute run or jog with a 1-minute walk. And then as you get even stronger, you may even do like a 10-minute run, and then eventually continuous running, 20 or 30-minute continuous run. And some people prefer doing run-walk strategy long-term, even for longer distances. That's up to you. But at least get to a point where you could run continuously for 20 or 30 minutes before you go to a straight-ahead traditional running program, whether you're training for a half marathon or whatever distance you're training for. So the key is progression, and don't rush the process. There's different run-walk protocols to get you from like your injured or injury recovery, like returning to run program with run walk. So you build it up and then you progress from there. So if you've been silent with pain, remember this: with the right diagnosis, making sure you know what you're actually working on, because again, oftentimes the back can cause hip pain. A smart plan and some consistency, you could get back to running pain-free. If you want more help on recovering from outside hip pain, check out my free training for runners. I'm gonna drop the link in the description below. Thanks for watching, and don't forget to like, comment, and subscribe for more tips on pain-free running and performance.